Planning, prognosis, non-surgical therapy, surgical therapy, adjunctive therapy, and prevention and maintenance. Diagnosis. Periodontitis is a branch of the dentistry dealing with the periodontium. The periodontium includes alveolar bone, periodontal ligament, cementum, and gingiva. Anatomical terms. Periodontal ligament PDL fibers between cementum and alveolar bone. Alveolar bone that supports teeth, gingival sulcus, potential space between tooth and gingiva. Periodontal pocket pathologically deepened gingival sulcus. Gingival margin, peak of the gingiva. Free gingival margin, gingival border. Free gingival groove, shallow, linear depression marking transition from free gingiva to attached gingiva. Attached gingiva, keratinized gingiva firmly attached to underlying bone. Alveolar mucosa, mucosa not bound to bone, non-keratinized. Mucogingival junction between attached gingiva and alveolar mucosa. Vestibule fold, transition fold between alveolar mucosa, a periodontium, and labiobuccal mucosa near the lip of the cheek. Semen, dentine, alveolar bone, gingiva, free gingival margin, gingival sulcus, gingival fibers, PDL, periodontal ligament, cementum. General dental anatomy. Non-keratinized tissue, keratinized tissue, gingival groove, gingival recession. Anatomical terms of gingiva. Periodontal disease. Periodontal disease, also known as periodontitis, is a complex condition that plays on the interaction between bacteria and its host, the patient. Microbial plaque, the initiating factor of periodontitis, accumulation of bacteria on the tooth surface. There are 3 stages of periodontal health. Periodontal health, absence of inflammation, PDL, periodontal ligament destruction, and bone destruction. Gingivitis, presence of inflammation, absence of PDL destruction, and bone destruction absent. Periodontitis, presence of inflammation, PDL destruction, and bone destruction. Pathogenesis of periodontal disease has number of steps. Subgingival plaque bacteria present microbial challenge. LPS antigens are the byproducts. Inflammatory response by upregulated host immune system. Cytokines, prostaglandins, MMPs lead to gingivitis. Tissue destruction when microbial challenge in chronic or potent health disease. Unhealthy bacteria, severe tissue inflammation, bone loss. Gum recession. The above image depicts the body trying to protect itself by retreating its tissues from the plaque and bacteria. Examination. Tooth examination. Teeth are examined for the following: erosion, teeth eroded from acidic food, drink, or stomach acid. Abrasion, mechanical wear, aggressive tooth brushing, resulting in loss of tooth structure. Abfraction, flexural forces resulting in loss of tooth structure, usually in cervical areas. Attrition, occlusal wear from tooth-on-tooth contact. Hypersensitivity, exposed root surfaces. Periodontal examination. The following are evaluated in the examination of the state of periodontal health. Alveolar bone loss seen on radiograph but not as reliable. Gingival recession, safe to gingival margin apically to expose roots from CEG to gingival margin. Tooth mobility indicated loss of the periodontal support. Suppuration, sign of many neutrophils in periodontal pocket. Furcation, branching point of tooth roots, can be seen with inner periodontal bone loss. Periodontal health can also be assessed with various measurements: probing pocket depth (PPD), gingival muzzle to base of pocket, clinical attachment loss (CAL) measures the position of the soft tissue to the CEG fixed point. Bleeding and probing (BOP) used to measure inflammation of periodontal tissue, seen when PPD or CAL is being taken. Ambidextrous CAL clinical loss, clinical attachment loss, and probing pocket depth PPD plus recession. Rearrange this formula to calculate the unknown variable. Recession can be a negative value when gingiva is swollen high. Furcation. A furcation is a branching point between tooth roots. Furcation involvement bone loss at the furcation area, but can achieve through shortened root trunk GEC to furcation and roots. Narrow distance between roots interradicular dimension. Cervical enamel projection. Enamel